Thanks so much for joining me for this conversation today. What is keeping health sector awake these days?
I think COVID is keeping us awake these days.
Yeah,
I think globally, it's. I don't think we get to experience these kind of things
yeah,
that we are experiencing right now as one people, right?
yeah,
So, it, COVID has definitely changed the focus and
yeah,
and really hyper given us a hyper focus on solving and dealing with this and in our fight against COVID and flattening the curve
yeah,
as well as providing the digital solutions that are required out there. So I think that is probably the biggest thing, of course, as
yeah.
it would be obvious. I think the other one is around the workforce, right?
Okay,
Like
yeah,
because if I look at it from my team's perspective, my focus is to make sure that their mental health is fine, right?
yes, yeah,
And that they're connected, they're feeling connected, they're feeling they're part of a bigger team,
yeah.
especially when our 100% of my team is now remote,
Okay,
right?
yeah, yeah,
And those kind of things are really important, like
yeah,
focusing on the people aspect of stuff, um,
yeah,
and making sure that our frontline workers are supported and looked after. So I think it's a lot of things, because it's brought both personal reflection and professional reflection all together.
okay,
So definitely, I would say, how do we pivot to get through this time,
yeah.
and also prepare for other things that may or may not come in the future, right? Because this is a big learning opportunity for us too, as well as survival opportunity.
Absolutely. Let's talk about the future. The biggest challenge that the healthcare system is facing now, the most advanced, well-developed healthcare systems were overwhelmed and couldn't keep up globally.
Mhm.
To be future ready, what approaches or strategies they should be adopting to handle any such future outbreaks?
That I've seen how organizations have started collaborating. I think collaboration is going to be critical.
Okay.
Collaboration on different things, not just and collaboration with the right level of communication, right? Like I
Yeah.
think there's just such an opportunity that things like this either bring you together or split you apart, right?
Yes. Yes.
And what I've noticed and what I've been like, really amazed to see is how quickly people and organizations are coming together to help
Yes.
and ensure that this is seen as a a global fight that we have against this common enemy that's COVID, right? And how do we collaborate across borders, and across the provinces, and just put the focus on making sure that we're doing the right things at the right time.
Yes.
So I think that attitude and um, uh, that switch into active collaboration is going to be critical for the future. There's
Oh,
no question about it.
okay.
Communication about what I know, you should know, is going to
Yeah.
be really important. We're seeing that from the leadership that we're seeing across Canada, right? Like we're
Yes.
seeing public health leaders step up, political leaders step forward and share information very openly, have
Yes.
very open dialogues. I
Yeah.
think that set the tone. That set the tone for society, right? And for organizations, for team members to just really communicate and share their opinions, share their knowledge and expertise to in a common fight, which has been really critical. The other one I think is going to be sharing resources, and it's not just about equipment; it's about data,
Oh,
right?
okay. Yeah.
Data is going to be really important to share because that's a critical component of the fight against COVID. Is what data do you have? Like, how are you seeing this evolve? How are you seeing population, case data evolve? And like, what are the outbreaks looking like? Where are you seeing clusters of outbreaks?
Yes.
And what are you doing? And how has that made a difference in curbing and flattening the curve? I think that's going to be really important for us to collaboratively learn through like collaboration, communication, and sharing data.
Yeah. Let's talk about technologies and systems that are being currently used globally. Which of them are proving effective, and what are health organizations doing across the world to increase their adoption?
Yeah, COVID has um, accelerated innovation. There is no doubt about it, right? Like it's accelerated innovation in every market, in every sector. And it's and if you look at like restaurants kind of pivoting into a different model of groceries, right? Like if you look at startups that are just emerging and really going into scaling up.
Yeah.
um, I, you know I think what I've seen is that there is like an expansion of solutions right now,
Yeah.
right? And there is a new market, there's new markets being created, which has been really good. I think that the key is that we're we develop tools that are actually solving very concrete business problems,
Okay.
right? For right now, if you see, everything is in the health sector is like really focused around how do we solve public health issues,
Yeah.
right? And that is making sure that the services for health are continuing. So you see a really big increase in virtual health, right? And also, what are problems that public health professionals are dealing with to in their fight with to curb COVID and flattening the curve.
Yeah.
So I feel that continuing down that path of making sure that there is a really strong value proposition in solutions that are being developed,
Okay.
that are actually solving really finite problems. So having a pulse on where are the emerging issues
Yeah.
that we're seeing across the world, and how do we bring in solutions to help that. I think that's going to be really critical,
Yeah.
right? And at the end of the day, it's all dependent on a call to action for citizens, right?
Yeah.
Like I think we cannot ignore that the biggest thing that we're trying to do is make sure that there are solutions in place for the people around us
Yes.
who are getting
Absolutely.
these healthcare services, right? So how do we engage them in this, right? So
Yes.
that the solutions are actually working for them and not just the providers, right? So I think there's a lot of patient empowerment conversations that are going to happen,
Oh, wow.
right?
Okay.
So that's my personal view, and like I'm you know really amazed to see how even competitors are coming together to solve problems together,
Yes.
right?
Absolutely.
And
Apple and Google coming
that's
together
yeah,
with
exactly. And I
example.
think that's
Yeah.
been really good to see. Yeah.
You talked about virtual health. You can count me among group of people who don't like visiting physician's office. So is telemedicine, virtual clinic the future of my visit now?
I think it will, yeah, I think it always was a part that was growing, right? Like I think we were seeing just before COVID, we were seeing emergence of services that were being provided directly to public,
Yes.
um, and making sure that people have a way of connecting to providers when they couldn't physically be there, which I think became really critical, especially in a pandemic situation, right? And I think people, whoever, even if folks were skeptical about it, are now seeing the value of it, right? And that includes people who are providing care and also receiving care. I think they're seeing the convenience of it, the utility of it, the effectiveness of it, and they also realize and that there are some services, there are some kind of health interactions that you're going to have that are not possible to do virtually right now, right? And
Yeah.
that there will always be room for physical kind of face to face in together, close proximity type of health encounters, and
Yeah.
that will always be there. But I think now this is another tool in the toolbox to
Yeah.
say, can we actually provide uh, uh, a, an experience for the patient and the provider that is seamless and
Yes.
can leverage the digital solutions that we have in place, right? So I think yes, uh, you can absolutely expect that this will continue to be part of the future state.
In coming years, what kind of initiatives do you see, especially IMIT initiatives, happening in public healthcare space? And what kind of talent would be in demand by these organizations so that they can continue scaling up their IT ecosystem?
I think there's definitely going to be a drive towards faster delivery and faster scaling up, right?
Okay.
So things like agile. development is going to be really key.
Okay.
So, like, because we don't have in a pandemic situation, we don't have years to wait. We have months or weeks to that we need to be able to go from a solution idea to a solution delivery, right? Or just like suite of delivery. So I think that's going to be really important.
Yeah.
Folks who fit into that, product management, product owners, scrum masters, and things like that. I think that's gonna, and healthcare is embracing that,
Yeah.
right? And so is the public sector now embracing that and really taking a leadership role in it,
Yeah.
which has been really great to see. And that journey actually started a little while ago, but we're seeing that the foundations that were laid for that are actually being very helpful now as we deal with the pandemic.
Yeah.
So that definitely will continue. I think also, what I would say is like artificial intelligence, predictive
Yeah.
analytics, right?
Yes. Absolutely. Yeah.
Right, like that's going to be really really key. And again, in public health, bringing the data that we've got now swaths of data, right? Like, and how do we use that to predict things so that in the future that we've got these outbreaks that will happen, or may or may not happen, like we've got some really good predictive analytics to be able to say, hey, this is what we think it would be like based on what we've seen before in COVID, right? And now we've got data from globally, right? And that's where I say it's like it's important to share the data, and that collaboration is going to be really important, is because that will help our systems and people and in our healthcare systems itself get better at how we deliver even faster.
Fantastic. Yeah.
Yeah.
On a personal note, what are your key takeaways from this crisis, and what would you start doing differently?
It's been a really interesting time. So, I don't know if you can hear my little guy like crying in the background, but there's always that, right? So,
Yeah.
yeah. So that, getting used to that, that's been really, really great to see that nobody, bats an eyelash when you're on a phone call or
No.
for work, and there's background noise, which has been really great. And
Yeah.
that's created a different team culture.
Yes.
Um, uh, I am really proud of my team and how they've been able to pivot so quickly
Yeah.
into a remote work and actually still stay connected.
Yes.
Personally, things like making sure that there's a switch off from work to life,
Yeah.
like a personal life, right? Because when you're going to work, you have got the drive, you're driving and you're kind of, you know, leaving it behind you. You physically are moving back and forth into a different space. So that uh, boundary doesn't exist anymore,
Yes.
right? So making sure that there is still a cutoff in what's work and what's life, that's
Yeah.
important. And I think it's been a really good opportunity to be present, right? And actually be engaged and enjoy things that we haven't been, that have always taken a lot more space in our minds, that
Yes.
actually don't need to. So that's been really nice as a family to be able to kind of come together and really enjoy the time together. I think the isolation bit of it has been difficult, and that's been difficult for everyone. It's good. It's like it's kind of nice to know that everybody's dealing with it, so you can actually talk about it, right?
Yeah.
So,
Yeah.
and it's like it is the situation. What I'm really kind of interested in knowing it is like how, as we come back to what people have coined the new normal,
Yeah.
what that will look like and how that will translate for people and the decisions they're going to make, right? Like
Absolutely.
there's this drive to get back into it, and come and start seeing each other physically and stuff like that, uh, but also being responsible about it, and everybody's threshold for that is different,
Yes.
right?
And also the
Everybody.
human side of work. We always talk about it in corporate culture, but
Yeah.
and we always see and hear about initiatives, and we participate in a few, but it has never been this clear. You talked about mental health just a few moments
Yeah.
ago,
Yeah.
of your teammates, employees,
Yeah.
and also isolation that everybody's dealing with differently, and that's blending with work, and everybody's working from home, and
Absolutely.
yeah, so
Yeah,
it's
and it's like there's so much research coming out about mental health stuff. So like if you look at like CAMH coming out with saying that in some areas that where they're providing mental health services, their services have gone up from like 25 phone calls to 700 calls a day. in small areas, right?
Yes.
And the next, like they also carved out and published, I think at the end of March or end of April or something like that, saying that the next pandemic that we're going to deal with is mental health, right?
I can see that happening for
Right.
sure. Yeah.
It's like, and you're seeing people kind of you know change because of isolation. So that's why it's so important to just, yeah, we're physically distant but not socially distant, right? I think and it was a really good thing that people changed that messaging and the terminology from physical, from like social distancing to physical distancing.
Yeah.
and and I think that's the next thing that, personally, I am really aware of, is that what will that look like for people who I'm interacting with,
Yes.
right?
Yeah.
And what kind of support will everybody, including me and my family, need, and what kind of support can we provide to each other so that we don't uh, feel like it's like there's a big gaslighting going on, that it never happened, right?
Yeah.
Like, it did
Yeah.
happen, it is happening, it'll
Yeah.
continue until there are, there are vaccines for this stuff. It's gonna be there, right?
Yeah.
And how do we support each other and not forget that everybody has a different threshold and everybody has a different journey?
One of the major realizations for me was everybody we work with and collaborate with, most of us have not been through an adversity like this before, in at least in recent history.
Yeah, yeah,
So collectively dealing with an adverse situation, I think all of us will get better because of it.
yeah,
Uh,
absolutely. It's
yeah.
so interesting because I like this earlier today. I had a team meeting with all the directors and some of the portfolio leads and stuff that report to me, and the first agenda item was, how are you feeling,
Yes.
right? Like,
Yeah.
and then the next one was, how is your team feeling,
Yeah.
right? Like, I think it's just really opened the door to have those conversations very clean and very, like, just like,
Candidly. Yeah.
just as a matter of fact, it's like, yeah, physical health, you're fine, I can see you, you're doing okay, I hope you're
Yeah.
okay, but like, what's happening with you? Do you need support? Do you need
Yeah.
anything you need from me? Do you need some flexibility, additional flexibility, things like that? And I think
Yeah.
they're just becoming such great conversations. I sent out an email to my entire team, just like a personal email to each one of them, just checking in.
Yeah.
And it was so great to hear back and actually get to know people even at a different level, to just say, we're doing well, we struggled in these parts, but we're really enjoying this part.
Yeah.
And it's just been really nice that way to bring people together. And I hope that stays. I hope that's a key aspect of our new normal.
Absolutely.
uh,
Absolutely. Thanks so much, Zen,
my
for stopping by
pleasure.
for this conversation and sharing your thoughts. Much appreciated. Yeah.
Thank you. And thanks for this opportunity. I really enjoyed it.